Hello, everyone, and welcome to the training for our 2023 Advocates Day for Safe Passage for Children at the Minnesota State Legislature, and that's going to be on Wednesday, March 22nd. So first, let me go into the overall process. For those of you who have been involved in past years, this is going to be a review, but that's generally a good thing. And for those of you who are new, I'm sure you will find this helpful. So the general process is that we make appointments for you with your state representative and senator. And when you get there, you generally get 10 or 15 minutes at the most, usually, to go over the materials. So we give you a handout to leave behind with the elected officials and also a handout for you to use as you talk through the talking points. Now, we have found that these meetings between constituents and legislators are the single most effective tool that we have to get legislators to care about, be concerned about, take action on behalf of children who are victims of child abuse and neglect. So your being there is a really powerful tool for us to move the agenda forward. Now, sometimes you might go to a legislator's office for a meeting and find that they're held over in some committee, and perhaps you might have time to come back, but more often the process is to go to the hearing itself and ask them to come out and talk with you for a few minutes. Their legislative aide or their LA usually can get a message to them that you're on the way, so they're expecting someone to tap them on the shoulder and ask them to come out. And if this happens, the conversation will probably be a little more rushed, and you may have to go through the talking points quickly and give them the handout to follow up. And then sometimes the worst case scenario is you just can't reach them. They're tied up somewhere and you have to go through the talking points with the LA, and then she or he will brief the elected official and pass it on to them. For those of you who are new, we usually have a more experienced person to go with you. And in addition, I recommend that you take the talking points, which we will email to you, and read them out loud to yourself for a few times. I usually read them over quite a few times, because then when you get to that moment and you've got to deliver these talking points in a short period of time, you'll be much more comfortable with them. Now, if they come up with questions, the legislators or their aides come up with questions that go into more detail than you know about, let them know that you will share those questions with us, and then we will get back to the legislators. So in between, if you have questions, just reach out to us. You can go to the website. There's contact us at safepassagemn.org. You can just email us, or if you have Stephanie or my email address or phone number, just send us a direct email or call us. Our numbers, if you don't have them, are at the end of this PowerPoint. So regarding the legislative session in general, let me give you some context here. As many of you are aware, this is the so-called trifecta legislature, where all three branches of government are controlled by one party, and in this case, it's the Democratic Farmer Labor or DFL party. And though the Democrats have a slim majority in the Senate, real slim, and only a small majority in the House, they're taking full advantage of the situation, and they are passing huge progressive priorities that have been languishing for probably 2 decades or so. Several senators and representatives have told us that they are authoring upwards of 50 or 60 bills apiece. So their workload is enormous. The bills are flying through the legislature, through the committees at a breakneck pace. Some bills that have been on the dockets for years have already passed. So we expect that many bills that are helpful to families and children will get passed this year, including a lot of stuff in mental health that we'll be very happy to see. Early learning scholarships I'll talk about in a minute, and childcare money. So many of you know, and this is a review again, the legislature operates on a biennial cycle, and this is the first year of that cycle. It's often called the budget year. When major budget, they have to pass a budget this year. They can't just sit on the last one. They have to pass it. So major budget decisions typically get made. The bill gets passed, establishes the budget for the next 2 years, starting in July. And that often has a ripple effect because it's built into future biennia. The second year of the legislative session is called the policy year or the bonding year, or sometimes both. And this is the time in those two areas, policy and bonding, they're taken care of. Now, at Safe Passage, we ourselves don't have a bill in the hopper this year. That's the first time in a while, because we had to focus our resources this year on producing a fatalities report and we just didn't have time for the usual pre-session ramp up. However, it's still important that we all get to the legislature because we still have three major goals for this legislative session, which I'm going to go into in detail. But briefly, the first is to call attention to this recently released report on fatalities, because it's going to set the stage for making what I hope is real progress in the next year or two on our agenda for children. Secondly, it is to support bills moving through the legislature that are important for child welfare because they are proven to actually reduce child maltreatment. So we want to support those bills. And third, we are, for the first time ever, planning to oppose a bill that we think is very detrimental to the interest of children. So first, let me fill you in on the first item. That's this fatalities review report. And I want to start with a shout out to Maya Caro, who was with us until the end of January this year as an Archbishop Ireland Justice Fellow through the University of St. Thomas School of Law. Maya did all of the data gathering and organizing of the quantitative information for this report. And the report covers the period from 2014 to 2022. And the reason for that time period is, many of you will remember, there was an investigative reporting series in the Star Tribune that covered the period from approximately 2006 to 2014. So we are picking up on the fatalities from that period to fill in the gap. As you may recall, also this TRIB series triggered the 2014-2015 Governor's Task Force on the Protection of Children, and that resulted in many recommendations, some of which were put into statute and have taken hold, gotten traction, but many have been ignored by the Department of Human Services and the county. So our strategic agenda since then has been, in large part, to continue to try to implement much of the unfinished business of the task force through either legislation or negotiation. So this fatalities report that we did is now receiving national attention, and it is leading us to new opportunities for safe passage and for all of us. For example, we have been asked to present our findings at the annual conference of the Bo Biden Foundation, which is focused on child protection issues. We are in early conversations with several scholars and think tanks about replicating the study in other states. So if you haven't already done so, I encourage you to read the report. It's featured prominently on our website. You shouldn't have any problem accessing it. Now, and I admit the report is quite long. So if you don't have time to read it all at once, for starters, I recommend that you read the 3-page executive summary at the beginning and then read several of the case studies. I think that will give you a pretty good sense of what we discovered. And some of the high-level themes of the report are, first, that the system has just become hardened. It's become inured to violence toward children. Secondly, the values of the system are really wildly at odds with the values of the community as a whole. In other words, people in the community as a whole really don't buy into what child protection is doing. And finally, one thing we're trying to talk to is, look, parents get years in this system to address their issues, whether it's with domestic violence, substance abuse, parenting skills, or whatever. But children, they don't have that kind of time frame. They have weeks or months to develop, particularly infants and toddlers, where their brain is developing so quickly. And so we have a real mismatch between the system, which is really focused on giving parents as much time as they need or want to address the issues that brought them into child protection, and children, the opportunity for them to develop normally is long gone by the time that happens. Now, we were really focused, as I said, on getting this report done. So we didn't get to the legislature, we didn't get to the party until kind of late this year. So we understand, with everything else going on, why we couldn't get legislation introduced. But we also aren't getting much interest or support from legislators around our findings and interest in working with us later, and that's kind of disappointing. So we hope you can help us to change that, and we believe we can. We believe we can use this report to start leveraging legislative changes starting on Advocacy Day, March 22nd, then working through the summer and fall, which is, I said, is going to lead up to 2024, which is a policy year. And a policy year is a good match for what we want to accomplish, since much of what we want to do is to promote policy. So it's policy in nature and doesn't require funding. Or we hope to use the impact of this report to get more willingness on the part of the department and the counties to negotiate around our proposals. Now, since your talking points are going to include some from the report, let me give you an overview of what we discovered. And this took 15 months to do this report. It was a bear, I tell you, but it was really turned out to be worth it. First, we analyzed 88 children who were killed by their caregivers during the report period, but this was only roughly half of the 161 child fatalities during that time. The Department of Human Services declined to share with us even the names of all of the children who were killed. So we were limited to identifying children from media reports. And our analysis demonstrated that many of these deaths then were preventable, and they were due to a child welfare philosophy which gave such high priority to the interests of parents and other adults living in a household, as well as to the goals of family preservation and family reunification, that child safety and well-being were regularly forgotten or compromised. Our analysis demonstrated that many of these deaths were preventable, and as I said, were due to this child welfare philosophy, which gave such high priority to parents. And we found that the core mission of child welfare, of course, is to protect children, but the system frequently left them in situations where they experienced life-altering neglect, repeated physical and sexual abuse, sometimes torture, and often over long periods of time. And in many of these cases, a number of individuals in multiple institutions, whether it's law enforcement or mental health or other areas, knew what was going on, knew about the ongoing maltreatment, and failed to act. As I said, the system has become inured to violence toward children, and the values of the system aren't aligned with the community, and parents get years to address their issues. We found as well that 14 cases out of the 88, that's 16%, included markers or signs of child torture, and 5 unambiguously met the definitions of torture across 3 different national and state standards. And of the ones that were not were ambiguous, it was largely because there wasn't documentation in the court records to say, for example, that we could say, okay, but that included psychological torture, which was one of the criteria. But very likely many more of these cases were clearly torture. Nearly half of the children, or 48%, died due to actions of someone other than a biological parent, including particularly domestic partners and kinship foster parents. We had a large number. We had 6 out of the 88 cases were kinship foster care parents, and that's 6 out of 7 of the foster care deaths. So that's a disturbing number in itself. The quantitative data and the case narratives raised questions for further study of whether counties may have left Black children in high-risk situations more frequently and for longer periods of time than children of other races. In brief, Black children were 18% of the child protection caseload, but they were 28% of the deaths, whereas white children were 50% of the caseload statewide and 25% of the deaths. And almost all the other demographic groups, including Native American, were pretty much proportionate to how many children were in the system. So it raises the question of, do we have different practices and policies regarding Black children and white children, such that they're affecting these fatalities and the number of children who die? As I said, nearly 10% of fatalities were in kinship placements, we think more due diligence is needed in terms of those kinship placements. There was systematic misuse of family assessment. Generally speaking, people say 20 to 30% of cases are okay to go into family assessment because they're lower risk. We're still consistently using family assessment for over 60% of cases. So we want to propose a policy that says use it one time, which is a policy Michigan has, and then it goes into an investigation, and never use it for infants and toddlers. We found the pattern of seemingly endless chances for parents to address chronic problems going over years and years until the kid finally dies. Children are returned home from foster care to the same risks that were there when they left, so things have not changed, and yet we send them right back to that situation. Medical providers missed or ignored red flags. Infants coming in with broken bones, an infant can't even roll off the bed, let alone trip or break their bone in some way. Alleged abusers get advance notice still of the first child protection visit. So it's wink, wink, nod, nod. You better tell that kid, you've got 3 or 4 days. You can tell them what they should say and shouldn't say. Children are still being interviewed in front of the alleged abuser. Workers still aren't doing fact finding in any kind of a standard way, if at all. So the structure of the report was that we did a tremendous amount of data collection, over 80 data elements, hundreds and hundreds of court records, both in not only in juvenile court with just petitions and family and child protection issues go, but family court where sometimes there were related custody issues, criminal court where there may have been a felony for conviction for malicious punishment of a child. We looked at all of those records, and for over 50 of the 88 cases, we got a fatality review report from the county. So we gathered all this data and quantitatively, and then we also analyzed the case data in terms of a case study for all of these 88 cases. And we picked out of these 11 stories of children that portrayed the system overall. It's a system that, as I say, has become inured to dangerous levels of abuse and neglect, and a majority of these children were infants and toddlers. So I want to emphasize that the conclusions in our report are illustrative. They are not anecdotal. It's not sort of, well, here's my story that proves my point, and then the other person has a story that proves their point. These are cases that illustrate patterns that emerged, patterns that are backed up by all of this documentation and quantitative data from the 88 case studies. And so these are, it's something that we think is really illustrative of the problems in the system and not one-off types of case studies. And we've received validation from half a dozen top scholars who've read these reports and said that, yeah, we really did a solid job. These are sound findings. So what we want to do with this is go to work with legislators. We want to get their interest. We want to get some momentum here and then continue to work with them between sessions. And we want them to help us with a number of things. First of all, we need DHS to survey counties to determine if the statute changes that were made in 2015 are actually being done. Multidisciplinary teams, that's in the law. Are counties actually doing that? We know that Hennepin County is. We don't know about other counties. The legislation said that no child protection case is voluntary, including family assessment. Is that true, or are cases still de facto voluntary if they go to family assessment? Counties social service agencies are required to talk with county attorneys and consult with them if parents are not cooperating with the case plan before they can close the case. Is that happening or not? Again, we know Hennepin is doing it. We don't know about others. We want to end the misuse of family assessment and reduce it from 60% plus of cases to only 30% or less being tracked to family assessment. Child torture was one of the things that we found, as I mentioned, and we want workers to be trained to recognize child torture and take appropriate action. We want a process to do more due diligence in kinship placements to make sure they are safe and nurturing placements for children. Again, we want to use family assessment only once and never for infants and toddlers. And then again, we want to stop, we've been saying this for years, the practice of giving advance notice of the initial child protection visit and stop interviewing children in front of the alleged perpetrator. And we want the Department of Human Services to start making these child fatality reports that they have public. So those are just some of the things, and it's an exemplary list to share with legislators. And it comes down to, those are a few of the items on your handout. So let me move on to the second item that we want to do during this session, which is to talk about early learning and childcare. We always have supported legislation that reduces the strain of poverty on families because the research shows that when you take some of that pressure off families, it reduces child maltreatment. Now, this is true for income support programs, SNAP or food stamps, some of the earned income tax credits, and the child care credits and other things like just housing, Section 8 vouchers, anything like that that provides some support to children, to families financially, has been shown to have an impact on child maltreatment. One of the programs in Minnesota is the Parent Support Outreach Program, which directly works with parents who are on the verge of getting into child protection and provides some of that kind of support. It's only at $4 million a year statewide. We've always wanted them to expand that program. Unfortunately, that wasn't in this year's budget. But those are the kind of income supports or financial supports that take the stress off families and have been shown to reduce child maltreatment. But services as well can do that. And so the second message this year is to support bills moving through the legislature that are important in this respect. And the big picture is that the areas that we're supporting the most are in the early learning category and in childcare. As we've said for years, early learning has been shown, things like early Head Start or quality programs, whether they're family-based or center-based, have been shown to reduce child maltreatment or recidivism by up to 50%. So that's one of the really well-documented, well-researched areas. We've always supported that. This year, there's a bill called the Great Start for All Minnesota Children Act of 2023. The House file is 2471, and it's the chief author is Dave Pinto, Representative Pinto, and in the Senate, it's Senator Wickland, Senate file 2229. It is a huge bill. It has $670 million for early learning scholarships. Now, most years, early learning advocates have been thrilled to get $30 million, and so to expand the program. I understand that this would take care of every child that is eligible, and it would expand the eligibility up to 5 years, and would also give priority to children in child protection and foster care, along with several other groups of children, such as those where their parents are in substance abuse treatment and so forth. It also says that families wouldn't have to copay. Their copay wouldn't be more than 7% of their adjusted gross income. And as I said, all children under 5 are eligible, and child protection and foster care get priority. There are other features to this bill, but that'll give you a solid idea. It's big. Also, there is another bill that, among other things, raises child care rates to a minimum of 75% of the average rates for the most recently surveyed year. That's House File 13. Again, Dave Pinto, Representative Pinto, as the chief author. It's already passed through the House. And Senate File 14, again, Senator Wickland, and it is working its way through committees. It's possible we'll get to the legislative session and some of these bills will already be passed. So then our message is, hey, thank you for passing this bill. Good job. Keep it up. And then the governor's budget really focuses not on more money for childcare slots, but on trying to build up the childcare industry and workforce. It's been a problem for years and years that childcare workers aren't paid enough. There aren't enough trained people. Family and childcare centers going under every year. A huge desert in greater Minnesota and in certain inner city areas where there's no childcare available. So this bill puts a lot of money into things like stabilization grants to keep people from going under, and training of workers, and giving people scholarships to be able to get training and get a certificate in this area. So it is just trying to build up the childcare industry so it can function and be successful. So those are some of the bills there that we are focusing on. It is a moving target. For example, the Great Start for All Minnesota Children Act once did not have the early learning scholarships in it, so bills are being blended together. So you may get a different set of bill numbers and one-line descriptions by the time we get to Advocacy Day in a couple of weeks. But we'll just have to be flexible in that respect. Then, in addition, we are going to oppose a bill, or probably oppose a bill for the first time this year. We've never done that before. This is a bill which makes it all but impossible to report prenatal or perinatal substance abuse. So when it comes to things like fetal alcohol syndrome or other avoidable developmental problems that children are born with, this bill would make it nearly impossible to report. For example, it requires the mother to give both written and oral prior consent before doing a toxicology screen on either herself or the infant when substance abuse indicates potential developmental delays in fetal alcohol syndrome. So that's when you look at all the criteria for what has to happen before you can even do a toxicology screen, it's a virtually insurmountable barrier. It also requires medical practitioners, not just medical practitioners, but advanced practice practitioners to evaluate when child health and safety criteria are met. In other words, only a physician's assistant or a nurse practitioner basically can evaluate that, okay, this child's health and safety is at risk. And so now we're going to report it to child protection. It doesn't allow other nurses or medical personnel any longer to report this. And it changes the criteria from reporting to notification. So that puts it on the child protection worker to decide the medical criteria for whether this is a risk to the child. And unfortunately, it's being supported by the Minnesota chapter of the American Academy of Pediatrics and by the College of Obstetricians. So this is making opposition to the bill more difficult. It's possible by the time we get to the legislative session, it'll be all over from the shouting, but the shouting won't be successful in opposing this bill. We're certainly not getting any help from the medical community. I'm at a loss to explain why on that, but we are continuing to look for support from at least individual physicians or advocates for children who have fetal alcohol syndrome. So we'll keep you posted on that. Hopefully we can get some additional support. So you are familiar with the Advocacy Day logistics for the most part. But the schedule has always been, there's a morning and an afternoon session. That is actually, I thought I cleared that out. The location is still to be determined. So we will let you know as we get closer. But generally, we have an opening session. We hand out the materials. We go over the information again, and we have the same thing in the afternoon. And then the morning session is 8:30 to 9:15, but some of the appointments start as early as 8, so kind of in and out of places. And they're in the state office building and the Senate building. So we ask you to come to that initial session, even if you're early, pick up your packet, your name tag, legislative handouts, etc. And again, we'll go over things with you. And then the afternoon session, very similar, 12 to 12:45. Again, I'm sorry, I thought I took those locations out because they're to be determined, but you'll spread out from there to the state office building. So with that, I just want to say that, you'll be hearing from Stephanie about appointments that she's making for you. Once you get to the Capitol, we'll have all that information. We also will have this information about how to reach us. Probably Lois, my wife, will be there. Stephanie and I will definitely be there. That's our contact information. We will post this PowerPoint on the website, but you can also find out how to reach us from just the emails back and forth with Stephanie. Please feel free to pick up the phone and call us or send us an email message or a general message on our website or directly at contact@safepassagemn.org. So thank you for watching this training video. Follow up if you have questions. We really need your support. You can make a huge difference, and we hope to see all of you on March 22nd. Thanks so much.